Good afternoon. This is Dr. Bill White again with the American Orthodontic Society. And this morning we started out on causes of malocclusion. And I want to continue that, so this will be number 2 in the list of malocclusions. And a lot of it starts real early. I mean, the nursing of the child is very important, and we covered that most of this morning. And this is something American mothers or people in the developed world are not going to be able to nurse their children right. So I hope some bright guy comes up with something that will duplicate this natural nursing of the child. A child does not bite together when he's nursing. So they swallow with a different type of swallow as the baby matures up to about 3 or 4, maybe 5. They'll have an infantile swallow pattern. Now that is a pattern where you do not bite together when you swallow. And I've done this so much in lectures and showed people how they can do it, but I'll bet you that there's not many of you out there that might read this will be able to do this. But I'm going to swallow without biting my teeth together. And you can do it, but you have to practice a little bit. So your tongue has to come forward, and your lips do a whole different muscular activity in swallowing without biting. Now I'll try to do this right here, and maybe you can see my lips. But you kind of put your tongue forward and hold your teeth apart, and it pulls your lips up, and you can look at a kid or an adult. I've had adults that were still swallowing with this infantile way, and you don't bite your teeth together when you do that. Now, if somebody becomes a chronic infantile swallower where they do this all the time and they don't bite their teeth together, the teeth don't get pressed against one another. And to me, what causes us to have this acceptable distance between the chin and the nose and the forehead, or up above the nose and the top of the nose, and then from there on up to the forehead. And people look nice. We're used to looking at them like this. But there are people who swallow so much or hold their mouth open, or chronic breathers that breathe with them through their mouth, and the teeth do not get the constant pressure. You swallow somewhere around 2,000 times in 24 hours. I never counted anybody, but they can put a machine on you that will register those things, and you're just keeping the teeth apart. And so if you do that too much, your teeth will move toward one another, and as they move toward one another, they're not growing now, they just drift down like this, and as they come down, or the bottom ones are coming up, your length of your face in between here gets longer, and that can mess up the appearance of anybody. You look there, their face may look like that. There's some child on record that had polio, and it destroyed the nerves in there, and he just never did bite his teeth together. And this kid has his mouth open as wide as he can, and his teeth had erupted almost together. This is the hideous thing, you see. So we need to get our kids swallowing right, and tongue thrust and all this taken care of. You get it between 4, 5, or 6 in there. Even some of them are through at 3. Then you bite together to swallow. You bite together, and your teeth get this pressure each time you do that. And if you do it this 2,000 times in 24 hours, you don't even think about it. You swallow, and you don't even think about it, but you're pressing your teeth together. And there's an eruptive force in the teeth. They're trying to get up here where they can chew for you. And if you don't have teeth, you have a pretty hard time getting by. But I've seen some older folks that had none and gummed it pretty hard. But that's not what we want. We want to stop these teeth where your vertical part of your face from this lower third of the face is the right amount. It's like the other third right there. And if you let this get longer, somebody who breathes through their mouth too much, then this becomes really bad, and it's really hard to lower this back down. And I've gone, scrubbed in on some of these orthodontic surgeries, and they take the teeth and cut the maxilla down and fix it where it'll close back up in a normal height. Now, a lot of these things that are wrong, you need to go back and start at the first to correct the problem. If you don't get it, the reason for the problem, you can have trouble with that case the rest of your life, or their life too. And so you need to get to the problem of this. So people that are swallow wrong and their facial structures moving together, and you call it a high angle case, and if you don't know how to do the orthodontics in a high angle case, you ought to stay off of it, because you got to keep them functioning as you go. And we teach some of that in this bonded blocks. You have to put them on the back of on your molar teeth and bicuspids, and that makes you bite harder, and you can lower the vertical dimension that way, but it's hard to do. So what I want you to do is to deal with these problems real early. Don't sit around and wait till they're 12 or 14 to do something. And you got little things you need to do that you need to do them right when it's at that point. And that's why I push for the pediatric dentist. I think it is ridiculous that they don't learn how to correct these problems young. Now, some of them are going together in groups and hiring an orthodontist to work in there with them, but they have to teach him, or somebody has to, because I've never seen in an orthodontic school where they took pediatric things like preventive and interceptive orthodontics and really taught it to the people. Some of these cases, you start them off when they're little bitty kids, and you may not finish them until they're 10 years old or even more than that. You need to keep seeing them for little bitty things along the way. And so that's what I need to get across to everybody. Now, there's things like ectopic erupting teeth. You'll have a deciduous second molar sitting up here, and the permanent molar may be down here at an angle, and it'll start growing into that tooth. Now, I've got a perfect example of that in ectopic eruption, so you can look at it, and it can eat into the deciduous tooth here, and you can put one of these little springs on it, and it'll just move that tooth out, and then it'll have a gap in between, and then you keep that pressure on it and pull it together, and you can put that 6-year molar up beside this deciduous second molar exactly like it ought to be. Now, if you're set around and you just watch it happen, here's what happens. It eats the root of this tooth off, and it goes, and the permanent 6-year molar moves past that tooth and runs into another bicuspid up here, and you've got, if you straighten it up in there, now many of you don't know how to straighten it and push it back where it should be, but you got to push forward on the upper teeth to get the thing to go back, and you put one of these springs that'll upright it, that's all right. But you shouldn't ever have to do that. You catch the thing when it's in the middle. When you see that it's resorbing the cells on the permanent 6-year molar here are just dissolving this. In the case I'm telling you about, the second root is already gone, but the tooth is not dead and it stays there. And if you try to prop it back here by prising on this deciduous tooth, you're darn sure will lose this deciduous tooth. It is your space maintainer. But if you put one of these springs on it, it'll pull it right back up here. Then you just keep the pressure on a little and pull it forward, and it'll put that tooth right where it ought to be. Well, that can be done by a pediatric dentist if you wanted to yourself. Or you could have a hard time somebody's not a dentist to do it, but it is something you can see what to do and look at these cases. Now, if the case goes up here and it's raised up, some people grind it off. You don't mess with it. Just bring it up, and the occlusion will hammer that thing down, and it'll be sitting right behind that. There. So that was another cause for real malocclusion, is not breathing correctly that way. Now I'm going to come back and we'll do several of these videos on causes that happen to the teeth. Now, if you don't correct the swallow part, the face can grow and get too long, and the person looks bad. You can take a beautiful lady or man, in other words, and their facial structure, they'll have a lot more face down here in the chin than they have from this point up to the eyes, and it just something is wrong in there. We have grown to like the correct position